good afternoon, or maybe it's midday wherever you are. Thanks very much for joining us. Thanks very much to GET Consortium for the very kind invitation to be a part of this very important webinar. This morning, I want to discuss and share with you a presentation rather on the influence of climate on infectious diseases and the links, the integrated links between climate change and infectious diseases. Now, just to give you a very brief background related to the Center for Biosecurity Studies, of which I am the director for. The center was actually established in 2019, and this was actually conceptualized by Professor Akin Abayomi, who is the Commissioner of Health in Lagos, Nigeria. And so he is also the honorary professor here at the Center for Biosecurity Studies. And the center really was designed to tackle a number of biosecurity vulnerabilities that threaten our Caribbean biological ecosystems that impact on health, environment, and also on climate. And within these three focal areas, you can see number 2 is the most appropriate focal area that we are tackling now, which is climate change and its impact. So when we look at biosecurity, there are a number of risk factors that can be categorized under 3 main headings, namely the environment, such as climate, humidity, this could be wildlife, resident wildlife that is present, transient wildlife, such as migratory birds as well. The human aspect, because in terms of our social or our human activities, we can actually increase or decrease our risk to infectious diseases. And then we come finally to infrastructure, something that isn't necessarily always factored in as it relates to infectious diseases, but actually play a very significant role in the dynamics of infectious diseases. When we look at the infectious disease triangle, what we're speaking of is what is the relation of disease? And there are 3 factors: the environment, the host, and also the pathogen. And changes in any of these 3 can influence and impact the infectious disease dynamic for a particular infectious disease. So when we speak of climate change, we speak of the global effect that change in climate is having. And we would have seen in the UK, in Europe, the intense increase in temperatures, heat waves that are impacting these areas that are not accustomed to these really high temperatures. And this is the global trend that you're seeing here to the left in terms of rainfall. We're expecting across the world less and less total annual rainfall. So the areas of aridity highlighted here in red will continue to expand. And this will increase the risk, obviously, for things like wildfires, for droughts. But we're also expecting intense, severe weather systems to increase both in frequency and also in terms of the strength. And so flooding will also become very, very prominent as well. So we have a bit of the both extremes as it relates to climate, of dry weather on one hand and then extremely wet weather on the other hand. And all of these actually influence infectious disease dynamics. This is, sorry, got ahead of myself. This is a project that we have at the center ongoing. It's called the Climate Infectious Nexus. And what this seeks to do is to understand better the linkages between climate, as you can see here, and then obviously the environment, the biotic form in terms of the wildlife, and also the other interrelated aspects and factors such as infrastructure, travel, both air and sea, and also in terms of the sustainable development that is ongoing in the Caribbean. So when we speak of infrastructure, here are some examples of infrastructure from commercial development, roads, drainage, even electrical supply, waste management, sewage and water management, also in terms of air ventilation and potable water. And these are all important because as the outside environment is changing, the impact of the physical infrastructure can also change. As temperatures increase, you get more of a urban heat island effect, and this can have a extenuated impact in terms of vector growth patterns, and also wildlife displacement from wildfires especially. And then also as it relates to rainfall, you're going to get increased rainfall, but also increased rainwater runoff. And this is going to lead to more flooding, especially flash flooding, and increased vector population growth, also a vegetative growth, and this could also influence rodent population growth as well. And here's an example of the link of infrastructure, climate, and also infectious disease. And we're looking here at dengue in Trinidad and Tobago, which is just south to Barbados, where I live. And what they found in this particular study is that there's a link between road networks and dengue case risk. And they found that class 3 and class 4 roads were strongly associated with dengue. And these persons, especially when they live less than 1 kilometer from forested areas, and as you can see here with road classes 1 and 2, it was predominantly less, and road 5, it was less as well. So there is something about class 3 and class 4 roads that predispose persons in Trinidad and Tobago to dengue disease. And we can even look at septic tanks. This is something that is not often considered, especially with vector-borne diseases. But all of this physical infrastructure creates artificial environments where these organisms, such as mosquitoes, sandflies, can actually adapt to their physical environment and start to proliferate. So these are all things that we have to consider when we look at climate, because they're all interrelated. And when we think of non-physical infrastructure, we think of international trade and international travel as it relates to both sea and air. And these can be entry points for several new and emerging diseases, such as we witnessed in the Caribbean, chikungunya, dengue, Zika, and now most recently monkeypox virus. And also your legislation plays a major role in how you actually tackle these diseases, and this legislation that governs both international trade and international travel. And when we think of humans, we think of the human behavior. So what some of the prominent human behaviors that actually influence infectious diseases? Well, one in particular is the pet trade. You see with COVID-19 and even with monkeypox that this is a high risk activity that is ongoing globally and continues to impact the rise and the emergence of infectious diseases. Water storage, wild meat consumption or bush meat consumption, our social behaviors, whether we wear masks or we don't wear masks, whether we do get vaccinated or we don't get vaccinated, and obviously, most important, personal hygiene. And all of these pathogens that you see to the right here actually are influenced by a lot of these human behaviors. So let's go a bit deeper in terms of an example of climate and infectious diseases. So this is a study of systematic review that we conducted on human hantavirus infections and climate in Latin America and the Caribbean. So there are a number of factors that we summarized that were important as it relates to human hantavirus infection, and this could be extrapolated to other rodent-borne and also vector-borne diseases. When we think of temperature, when we think of humidity, and in this particular case, rainfall as well. And there's also a question mark around particulate matter. So within the Caribbean, we suffer from inundation of Sahara dust that comes from the Sahel region in Africa. And could this increase in particulate matter actually increase the risk for vector-borne diseases, such as hantavirus that is transmitted by aerosols? There were some studies in China that showed that there was a correlation, but there have never been any studies in the Caribbean looking at this. And when we think of natural events, so climate, in terms of the factors were examined, but not the individual climate impacts, such as wildfires, floods, and hurricanes. This needs more analysis. But here is to the right, the summary of the results. We found that as it relates to rainfall, there was a very strong positive influence of climate on hantavirus disease. And for obvious reasons, the rainfall will increase the vegetation growth, also the food, and also in terms of the reproductive mechanisms of the rodents. The earth is softer when there's more rain and they get to burrow, and so therefore they can go into their mating. Food is abundant, so therefore the populations increase. Temperature was also positively associated, but also it was the highest negatively associated factor as it relates to hantavirus, and humidity also played a role as well. But what we did see as we looked, and this is just a diagram showing you the different countries where these studies were conducted, we see that there are a number of different factors that all go together. Climate, social behaviors, or social factors such as Human Development Index, social vulnerability, the demographic factor in terms of age and gender, also abiotic in terms of the geographical location and altitude, and then several other biotic factors from sugarcane production, rodent host distribution, vegetative areas, and also farming activity. So when we speak of the global health security issue, I think currently what is missing within the global network is that we need to be able to examine all of the data that can then feed into a risk model that is dynamic, that is responsive to the individual changes in different countries. And one way we could do this, I mean, we already have a preponderance of air travel data and sea or cruise ship travel data. Are we leveraging this data to inform these risk models that can then inform individual countries of how best to manage the entry of these infectious diseases into these countries and regions? We have epidemiological data from WHO and also WOAH, which is the World Organization for Animal Health, and then linking it with climate data. And these can then feed into different types of models, whether this be foodborne, airborne, insect-borne, rodent-borne, waterborne. And this is important for these ports of entry so that you can then determine with screening and assessment of the level of infectiousness of persons and also the infectious risk coming in through these ports of entry as it relates to border security. And then we have this kind of misnomer outlier as it relates to migratory data, because when you have border security systems, they are fine for movement of both humans and goods across borders. But when you factor in migratory animals, these do not comply with these particular protocols. And so this is something that we have to factor in. And this is quite evident with the ongoing avian influenza disease that we are seeing across the world. And then you can have a risk stratification based on color. And this is an easy way in which we can help to reduce the impact of these infectious diseases on global health systems. This diagram just shows you these are the risk factors as it relates to the entry of a pathogen into a country, whether migratory animals, air or sea travel, trade and travel, and marine trade and travel for the particular host country. We have the climate data, and then we have a lot of these different factors that influence spread from food, water, waste management, farming and agriculture, the urban planning, and this is important because this is the infrastructure, the road development, and finally, the resident wildlife that can then continue to amplify the particular pathogen. So one thing that has come to the fore during the pandemic is in terms of diagnostics. And there's an ongoing debate about PCR versus rapid tests, and there are always going to be trade-offs. As we see here, PCR is more sensitive for the infectious period and identifying infectious persons. However, I think with the rapid antigen, there is also scope for this because when you think of PCR, it is expensive. It takes a significant amount of time to perform. And so the window of opportunity as it relates to border screening is limited. And so I think in terms of developing rapid tests that will be able to quickly evaluate persons as they move across borders is going to become increasingly more important. And I think a lot more research is needed in that area. And this is what I mean about the infectious diseases, because you really want to ideally identify persons in the prodromal stage or at the very beginning of that symptomatic area, because you really want to cut those chains of infectious disease transmission. And this can only occur when you identify persons as early as possible within the infection. And so this is going to become more and more important, because I think this is where the advantage lies for global health systems. And some of the prospective work that we are currently conducting, we're looking at systematic reviews on climate and human dengue, which we are going to hopefully soon publish, and then the impacts of climate and human leptospirosis in the Caribbean. And we want to explore the collaboration with the GET consortium to examine a number of infectious disease issues that are related between Africa and also the Caribbean. And we are actively exploring a collaboration with Yale University, because they have a Center for Climate Change and Health. And we are looking to see how we can develop that to strengthen, for instance, in research grant proposals and access to grant funding. So in summary, what we're looking at, we're saying that global health security needs to change its approach and do so quickly. We need to leverage data collection, rapid risk analysis, and also rapid diagnostic testing. And this is done to determine the infectious risk that persons pose. Also, we need to rapidly communicate this risk to the public, because that's where the risk lies in terms of the behaviors, because we want to break and rapidly break infectious chains of transmission. And we need to design these systems to account for the dynamic change of risk that we are experiencing in those three factors that we mentioned, in terms of the environment, in terms of the host, and also in terms of the pathogen. And the global health security systems need to be able to rapidly adapt to be able to manage this type of risk dynamism. And that is the end of my presentation. Thank you. And I will be available for any questions anyone may have. So thank you very much, and back over to you.
Thank you very much, Dr. Douglas. Thank you.